Hey everyone, and welcome. Today, we're jumping in to take a guided tour of a medication you've probably heard of, Citalopram. Whether you're just curious, or you know someone who takes it, or you're just trying to understand more about mental health treatments, we're going to break it all down for you nice and clear.
So, here's the plan for our tour. First up, the absolute basics. What even is citalopram? Then, we're going to get a little scientific and look inside the brain to see exactly how it works. After that, we'll talk about who it's actually for, what you can expect when starting it, and of course, the side effects. And we'll wrap up with some really crucial safety warnings that you absolutely need to know.
All right, let's dive right in with Section 1. First things first, what are we actually talking about when we say citalopram?
Okay, so on a technical level, citalopram is what's called an SSRI. That's a mouthful, I know. It stands for Selective Serotonin Reuptake Inhibitor. Basically, it's a type of drug designed to work on a very specific chemical messenger in your brain, one that's a huge player in how you feel. And that key player, it's a chemical called serotonin. You can think of serotonin as one of the brain's main mood dials. It helps manage everything from happiness and anxiety to sleep. So really, to understand citalopram, you first have to understand serotonin. He's the main character in this story.
So, how does this stuff actually work? Now we're going to peek inside the brain's incredible communication system. And don't worry, you don't need a PhD for this part. We're going to make it super clear. All the magic happens in a place called the synapse. I want you to picture a tiny, tiny gap that sits between two of your brain cells. It's not a physical connection. It's more like a microscopic communication port where messages get sent from one cell to the next. So in a normal, everyday conversation between brain cells, it goes like this. First, one cell releases a little burst of serotonin into that gap. Second, that serotonin travels across and plugs into the next cell, delivering its message. And third, this is the important part, a little transporter protein comes along and acts like a vacuum cleaner, sucking up any leftover serotonin. This cleanup process is called reuptake.
And this is exactly where citalopram steps in. Its entire mission is to block that vacuum cleaner in step 3. It essentially puts a block on the vacuum hose. By doing that, more serotonin is left hanging around in the gap for a longer time, giving it more opportunity to pass its message along. The whole idea is that this boosts the signal between those brain cells, which can help lift mood.
Now, you might wonder why that first S in SSRI for selective is such a big deal. Well, older antidepressants were kind of like a sledgehammer. They affected a whole bunch of different brain chemicals all at once, which, you can imagine, led to a lot more side effects. SSRIs like citalopram are more like a scalpel. They selectively target the serotonin system, and that precision is a huge reason why they're often much easier for people to tolerate.
Okay, so we've got the science down. We know what it is, we know how it works, but who is this actually for? Let's talk about the real-world uses and why a doctor might prescribe it.
Officially, here in the US, the FDA has given the green light for citalopram to treat two specific conditions. The first is major depressive disorder, to help with those core symptoms of depression. The second is panic disorder, where it can help make those sudden, overwhelming panic attacks less frequent and intense.
But that's not the whole story. You'll often hear the term off-label use. This is when doctors prescribe a medication for something other than its official FDA-approved purpose. It's super common and totally legal. And for citalopram, that includes things like generalized anxiety, OCD, PTSD, and even PMDD, which is a really severe form of PMS. All right, let's get into the practical stuff. If a doctor does prescribe citalopram, what happens next? What's the dose like, and how long does it take to work? This part is all about managing expectations, which is absolutely crucial for this kind of treatment. And I really want to stress this part. Citalopram is not a quick fix. It doesn't work like a painkiller that kicks in within an hour. You might start to notice some small improvements in things like sleep or energy in the first 2 to 4 weeks. But the full intended benefit for your mood, that can often take 6 to 8 weeks to really build up. Patience is the name of the game here.
So what about the dose? Well, for most adults, the max recommended dose per day is 40 milligrams. Now, no one starts there. A doctor will almost always start you on a much lower dose and then slowly, gradually increase it over time to see how you respond.
But that max dose gets cut in half, down to just 20 milligrams a day for certain people, specifically patients over 60 years old or anyone with liver problems. And there's a really important safety reason for this. At higher doses in these groups, there's an increased risk of a serious heart rhythm issue. So this lower dose is a critical precaution.
Okay, let's talk about something that's on everyone's mind with any medication, side effects. It's so important to have a clear picture here and to be able to separate the things that are common and usually fade from the things that are serious and need attention right away.
We can really group side effects into two buckets. In the first bucket, you've got the common stuff, like nausea, maybe a dry mouth, or feeling a bit drowsy. A lot of the time, these are your body just getting used to the medication, and they often get better on their own. But then there's the second bucket, the serious stuff. These are much less common, but you need to know about them. Things like serotonin syndrome or heart rhythm problems require immediate medical attention.
And I want to be crystal clear about serotonin syndrome. While it is rare, it can be life-threatening. It's basically an overload of serotonin in your system. The warning signs are things like feeling really agitated and confused, having a super fast heart rate, muscle stiffness, and heavy sweating. If you or someone you know experiences these symptoms, this is a medical emergency. You need to get help right away.
All right, we're at our final and honestly most important section. This is the stuff that you absolutely positively need to know for your own safety when it comes to warnings and drug interactions.
This right here is the FDA's most serious type of warning. It's called a black box warning, and it says that for people under the age of 25, these medications can, in some cases, increase the risk of suicidal thoughts and behaviors, especially right after starting or changing a dose. It doesn't mean it will happen, but it means that young people on this medication need to be monitored very closely by their doctors and their families.
You also have to be incredibly careful about what you mix citalopram with. Combining it with a much older class of antidepressants called MAOIs is a huge no-no. It can be fatal. Mixing it with other medications that also boost serotonin can put you at risk for serotonin syndrome. And even common over-the-counter things like aspirin or NSAIDs can increase your risk of bleeding. And alcohol? It's generally a bad idea, as it can make depression worse and increase drowsiness.
And one last absolutely critical piece of advice. You can never, ever just stop taking this medication cold turkey. If you do, you can get something called discontinuation syndrome, which is basically a withdrawal reaction. People report feeling dizzy, anxious, and getting these really bizarre jolting sensations they call brain zaps. The only safe way to stop is to work with your doctor to slowly and carefully reduce the dose over time.
So, when you put it all together, what's the big picture? Citalopram is clearly a powerful tool in the toolbox for mental health, but it's not a magic bullet and it's certainly not a simple fix. It demands respect, patience, and a really clear understanding of both the benefits and the risks. And that reality kind of leaves us with a bigger question to chew on. As our scientific understanding of these medications gets more and more advanced, is our society's overall approach to mental health actually keeping up? Something to think about. Thanks for joining this tour.